Again, thank you for being here today. I have a CHIL member that's going to introduce our next speaker. This is Christina Mitchell. She goes to Martinsville High School, and again, she's a member of CHIL.
Miss Nancy Haynes received her undergraduate degree from Townsend University and Master's in Education Administration and Supervision from Loyola College. She helped to coordinate successful efforts in Roanoke County to combat underage drinking that was recognized by the Community Anti-Drug Coalition of America as the winner of CACA God Outcome National Award in 2010. Let's welcome Miss Nancy Haynes.
Is this working? Can you guys hear me in the back? Yeah, okay. I am 20 years Maryland public school special ed teacher, so I do have a teacher voice, and my 3 kids, who are now 23, 21, and almost 16, tell me I have a great loud voice. So if you can hear me, I'm fine with this. Are you guys fine with me here? Okay. All right. Thank you very much for coming. I am literally, I'm very honored that Katie asked me. I am in Roanoke, and we have a drug-free community support grant there in Roanoke. So I'm just here as one of you all, okay? And what I like is these are all the youth right up front, right? I love it. Okay, I love it. This is what makes the oh, you guys back there? Why aren't you guys up here with me? This is what really makes the coalition. We have, I'm going to explain to you what we do with our youth, but these, I don't know, some of you have been up to YADAP, the regional YADAP, you guys, yeah. So when we've been doing regional YADAP now, I think it's our 7th or 8th year up in the Roanoke area, and it's modeled after the statewide YADAP yearly at Longwood University that now is housed at ABC. And we are very, very fortunate because the CHIL group and Hay have come up there, and they just love what you guys do, and those little yellow things that you always pass out, right? Okay, so let me see the hands that are part of a coalition, any place in the state of Virginia, just so I know who, okay. So, other people in the room, coalitions are new to you, okay? And I think we have 3, we had Wayne who just left from Richmond, Bonnie, you're from down here with Katie, and then Nancy's here from Stanton, right? Yeah, okay. And we're from Roanoke, okay? All right, so we have been around since 2001. I don't know if anybody knows the name Joanne Burkholder. She actually was the person that brought all this. I started as a volunteer when I moved to Roanoke. I moved there in '99, and then I met Joanne. So this was somewhat new to me. I was sort of on the intervention end of education. I worked with lots of kids at risk and those that were emotionally disturbed, all that kind of population, and then got involved in this. So this is our mission, and really I like to add that we foster the health and development of Roanoke County's youth and also the adults and community. I want you to think about this as all health. Everything that we do is all about health. It's not, I mean, everything we do, we put in our brain, it's about health. And that's what, and our biggest challenge, I will tell you, continues to be my peers. The parents and the adults are still the challenge. I can get tons of youth together, and they will tell me the real deal and tell me exactly what's happening. It is the challenge of the adults. Okay, so we are connecting to promote healthy communities. We partner with the medical community. I will talk to you about Carillion Health System, or Carillion Clinic now, that what we did with them. Statewide youth leadership opportunities. YADAP is just an awesome conference. How many of you have been to the statewide YADAP in Longwood? And would you not say that it's like one of the greatest things? Okay. And I hope that all of you go back to your communities. You do not have to be a coalition to send kids. They can come from a youth group at church, they can come from school, they can come from a group at the YMCA. It is an awesome opportunity for kids, and there's about 500 that get together for 1 week at Longwood University. It's always, I think, the 3rd week of July. And we are spreading the seeds of the drug-free community program to far southwest Virginia. meaning even down towards beyond Virginia Tech, down beyond Pulaski, into as far southwest as Russell. I am going to talk to you about, anybody heard of, other than the DFCs that know this, Coalition, the Community Coalitions of Virginia, CCOVA. We are now about 3.5 years old, and this is a statewide organization, nonprofit, that was born out of the Community Coalitions of Virginia, which there's about 20 plus, that wanted to really get together and start to share what we all do, so that we really want to build on local community coalitions, okay? And then regional training, evaluation, and network, and that's what CCOVA does. And Katie can get you that information, and you can be part of that. You don't have to be a group. You can join as an individual. Youth can join, and we do regional training and networking every year in March, and we're also trying to bring an academy here to the state of Virginia to talk about this kind of work. Okay, so this is Roanoke County. How many of you been to Roanoke? Okay. It was sort of culture shock. I came from Annapolis, Maryland, so I'm a Maryland, DC person, and I got down there and I was like, wow, this is far away. But it's absolutely gorgeous. I love all the mountains, and the county surrounds the city. So we also have another DFC that sits in the city and covers the city of Roanoke, Salem, Botetourt, and Craig County. Okay, so I'm going to pretty much go through very quickly SPF. That stands for Strategic Prevention Framework Process. And this is what we did and applied for the got outcomes. We have data that dates back to 2002, actually probably 1998, but we use the Youth Risk Behavior Survey. Everybody who is familiar with Youth Risk Behavior Survey, YRBS, okay? So this is a survey that we are allowed in Roanoke County. Dr. Lai is our superintendent. We are allowed to survey every single 6th through 12th grader every other year. So our data at the end is approximately 7,500 to 8,000 kids. And she also allows every school to have their own data, and she allows it to be reported back to the parents. She believes that there is no school system or community that doesn't have a problem. So the more that you know about that problem, the better that you can fix it. And the way we do it is we are very big into collaboration and really not working in silos, but saying that really when you build partnerships and collaboration, it just makes everybody stronger. So in 2002, our YRBS told us that 73.3% of Roanoke County high schoolers said that they had used alcohol, and it was 57.4 for cigarettes and 41.3, this was lifetime, okay? So the percentage of high school youth that used alcohol in the last 30 days was higher than other substances and also higher than the national average reported in 2003. So this is where we was baseline. This is when our DFC started. We talk about whose problem is it anyway. You can fill in that blank with anything, but a school does not have a particular problem. Problems happen in the community. School is where kids are. School is where we get our information because they're all in one place when we get this data. However, a particular problem is a community problem that's manifested in school and other locations. I'll give you an example. Anybody hear about the big party that happened last March in Roanoke County, got all the way up to the Richmond Times? Okay. What the media did was they put the label because most of the kids were from Kenton Valley High School. Most of the kids were baseball players. It did not happen at school. It did not happen on a school night. It did not happen on school property. It happened in the community on a Saturday night with a mom present in the house and another 21-year-old present in the house, knowing that these kids were drinking. So it wasn't a school problem, community problem. We really had to respond to that and say, media, come on, help us out here because it's not a school problem. Yes, they were from a particular school, but it did not happen in the school. Okay, so we looked at root causes, we asked why, and this has become sort of a logic model. So our community assessment determined the following root causes. Number one, ease of access, and in 2004, almost 47% of middle schoolers and 83% of high schoolers said it was easy to get. Number two was community norms favorable to adolescent alcohol use, and number three, youth begin using alcohol too early. So in your communities, If you ask why about alcohol, how many of you would say that at least one of those reasons is a why in your community? Okay. What's the easiest for you guys? Which one for the youth? Is it easy for you guys to get alcohol? Are there norms? Do people say it's okay if you guys drink under the age of 21? Okay, and is it, I'm going to use it's called a Shannonism. Shannon Weatherly is with the Office on Drug Control Policy of the White House, where we get our drug-free community support, and some of you may have met her. And she taught me this a long time ago, that alcohol, and I would venture to say prescription drugs, and I would venture to say marijuana, and you can put in all kinds of risk behaviors, is an adult problem with a youth consequence. Does that make sense to you guys? Adult problem with the youth consequence. And why would alcohol be an adult problem with the youth consequence? Because they're either turning their head, they're either drinking with you, or they're either saying, write a passage, it'll be better if you guys are safe home with keeping the keys, okay? So that's why we have to look at this from a community and adult perspective and change some of those kinds of perceptions. Okay, we looked at local conditions. I'm not going to read all these to you, but I'm sure that you could agree that some of this is happening in your community, okay? Where supermarkets and convenience stores are a significant source. Parents are not always aware of how early drinking begins. Parents lack skills to communicate a no alcohol message, or they're mixed messages, okay? They're mixed messages. If every time we have to have alcohol with a gathering that's a mixed message, or at every football game, if you're sitting around watching TV, and every time we've got to have a couple of 6-packs of beer, that's a mixed message. And if we're tailgating, we're already down to tailgating at high school level, and what we found out in our community, we're going to talk about this in a couple slides, is that there were these great tailgates that were going to promote just school spirit on school grounds that parents were coming to. But when they found out that there were going to be resource officers and police there checking to make sure that what was in the red cup was not alcohol, because you can't have alcohol on campus, they moved it into the neighborhoods. So again, do we have to have alcohol at every single function? And what mixed message do we send to our youth? Okay, these are a lot of data sources. Again, some of these slides were used at God Outcomes, so you'll see all of you have access to these kinds of data sources to really look at. One data source doesn't tell all, so you really have to, and that's part of the collaboration, is actually collaborating with, we collaborate with Roanoke County Police, Virginia Department of Ed, the ADC has certain data on compliance checks, Virginia MAD's website. Okay, so here is our trend data. And so and I'll talk about the implementation of some of our strategies, but this is actually the data that we have been keeping, and with the implementation of some of these strategies I'm going to show you, this is where we have got these numbers to continue to move the needle in the correct direction of use. So it went from 2002, ever used alcohol, down to 62%. One drink in the last 30 days went from 45 down to 36. First drink before 13, 25 down to 20. Drove while drinking, that went down in 2006, and then it sort of stayed steady. The binge drinking, I'll talk a little bit more about that, but that's gone down 4 points. And then this risk of harm, and that's a piece where, again, we send mixed messages. As students get older, the risk of harm goes down with alcohol, and sometimes it stays the same or is even higher with cigarettes and marijuana. So again, some mixed messages there. This is middle school. We actually went in and did a lot of implementation in 2004 in high school, because if we would have gone to middle school administration and said, you guys got a drinking problem in 2004, they wouldn't have listened. So that data started to come back, and in 2006 is where we started to see a bump up. So what I want you to think about is what was happening around 2006 with middle schoolers that would have helped, would have gotten them to be able to have access earlier to risk behavior? What would have been started in around 2006 and now is even higher? How about any of the youth? What's something in your life that middle schoolers have a lot of access now to? Internet. Other thing is cell phone, okay? Facebook started in 2005. My daughter started college in 2006. That was the coolest thing. Only college students were allowed to have Facebook. 2 years later, she got very upset because her high school brother, he opened it up to high schoolers. Then she got really upset because by the time her younger sister, who's now a 10th grader, in 8th grade, wanted to have Facebook. So I will tell you that the underground communication system that youth use, and now, how many of you guys talk on the phone? How many of you guys text? Raise your hand. All right, so we've gone to a very different way of communicating, and that is absolutely the choice and source of getting a lot more information to each other. Okay, this is marijuana trends. We are concerned because risk of harm in 2010 went down, and when the risk of harm goes down, use goes up. And this is another piece where we are going to have to start looking at an action plan and really a logic model around marijuana. And it certainly has connections to what's happening nationally and the fact that there are so many states making this legal. We were very fortunate to have Dr. Nora Boca. She is the Executive Director for National Institute on Drug Abuse in Bethesda, Maryland. She was in Roanoke for a lecture at the Virginia Tech Research Center last Thursday, and we were able to meet with her. Our coalition was, and she says that there's a lot of data that she says look at in cigarette smoking connected to marijuana use. And it was very interesting because we had youth there for her to hear what they're saying at both the high school and college level. Okay, this is middle school marijuana use. Look at the risk of harm there. It's up in the 90s now, and it did drop. Okay, I'm just going to give you one. This is one high school in Roanoke. And so this is what one high school reported in 2010. And we do a lot. YRBS has, for high school, almost 100 questions. So we talk about a lot of different areas of risk behavior. Okay, and we've changed this over time to ask them very specific questions about does their family have clear rules. We also now have a parent online survey asking the parent some of the very same questions, and interestingly enough, the parents think this starts at least 2 to 3 years later than what the kids say it really does. Okay, we are also, here is the information about the questions that we ask with technology. We started to also in 2010, we started to ask the first question about sexting and about, and then we have some new questions in there about texting and driving. So 35% of our high schoolers are saying that they're texting while they're driving. Okay? But you can see that almost 92% say they have a personal web page. So that's, and it's going to be interesting. We're going to do this again in February to see whether or not that even grows more. The bullying in 2008 went from hallway, and in 2010 moved over, 2006 it was in the hallway, in 2008 it dropped by 50% of where it happens to over the internet, because there were so many kids that were connected through technology. Okay? We are very concerned about the sending and receiving. We have very clear guidelines in our school system about bullying also, and then we have had to work with Commonwealth Attorney and our Roanoke County Police have had parent education nights about this because parents did not realize that it's against the law to do some of this stuff. So we worked together with them. Here's some other risky behaviors about inhalants. Wainfred that just left, their coalition has done incredible things that are nationally known about inhalants, and that number I got from him, 93% of those that continue beyond initial experimentation want to use a list of drugs. That's very easy because it's right in household. And then this is middle school and high school over-the-counter and prescription drug use. Okay, high schoolers, and we are seeing a very high increase of it's increasing with the over-the-counter and prescription drugs. Okay, so here's some of the implementation. We provide information. How many of you have done sticker shock? Okay, that's on ABC. It's fun, it's easy, it is a collaboration with law enforcement, and it's basically a sticker that actually warns adults that it's illegal to purchase for 21 and over. And youth and members of the community get involved, and you go, and our area, Stop in Stores, allows us to go into any of their stores to do this. Okay, we have a parenting program called Guiding Good Choices, Staying Connected with Your Teen. Anybody heard of that particular program? It's an evidence-based program. We've had it since 2002. Again, this is something that we offer in actually the entire region, because we've trained other coalitions and other groups to be able to use this program. This is modifying a policy, Stop in Stores. We supported them changing their policy. I think everybody knows that when you get your license, it's vertical, and it can stay that way past 21 unless when you turn 21, you go to the DMV and actually get it switched to horizontal, because sometimes it's not, it doesn't expire till later past 21. So what they did was they decided the only way we're going to stop some of these compliance checks that were negative is to actually say we're not going to sell to anybody that doesn't have a horizontal license. And it did cut down, and it increased, 70% increase in compliant rates in Stop in Stores when they modified that. Again, collaboration, and they felt from a business perspective they weren't going to lose that much money, and it was going to keep the community safer. Okay, anybody see this face before? This is our infamous Judge Trumpeter. Phil Trumpeter is just an incredible leader in our community, and he's known statewide. Everybody, any of the youth, you go through a licensing ceremony to get your license? Okay, his is 92 minutes long. Can you guys beat that? No? Okay. He truly, truly believes in this ceremony. There's a dress code policy. You must come with an adult. He is very specific in this ceremony to talk to families and parents about why the age went up to 21, and that it is a privilege, not a right, to have this license. He does not give the license to the student, he gives it to the parent. And he also now, and we have some of these if you come into our workshop, our brochures now he has specific questions that he tells the kids that they can ask their parents that are directly related to either drinking or risk behavior. And then he has specific questions that the parents can ask the kids. So he's got these questions, and they're now in print. So when they leave, they've got this. He also asks the parents to please give that license after you've had at minimum a 10-minute discussion. Okay? So he's very, very specific. He works very closely, sits on our council. He just called me last week to talk to me about a private school who ended up having an open house with a lot of alcohol, and the mom was intoxicated, so she asked her 15-year-old with a learner's permit to drive home to Floyd. Well, they left the city, went to Roanoke County without headlights, so they got caught in Roanoke County, ended up in his courtroom, and he said shame on that school. That school did not think about what they were doing when they had the alcohol, and shame on this mother that allowed her 15-year-old. So in that way, he believes that that school needs to get on board with understanding what this prevention is, and what does that mean in your Okay, this is another increasing barriers. We do this during prom time, where we actually give this out to some of the flower shops and the limos, and working. This is just one of the pieces of information to remind parents that please, don't drink during prom time. And then we have worked with Roanoke County Police, supporting them since before 2008, but we actually did a lot of pointed patrols, they call them, at football games, and we continue to increase those kinds of high-risk times, homecoming, prom, graduation season, and when we know that they're moving into the neighborhoods, then that's where the police can go and patrol those areas. Okay, this is changing practices and policies again. A year ago, this was actually my daughter's school, Hidden Valley High School, had the first homecoming. And the police decided that they would be there when the kids came in to the, from going out to dinner, and if for cause, they had breathalyzers there ready. So there were at least a dozen kids that blew, and they had been drinking. They then figured out one of the kids that had graduated had the alcohol. They went out into the parking lot, found it. In the meantime, and these were all seniors, in the meantime, many of them were texting to their friends that were coming in, don't come in, you're gonna get caught. Some of those kids didn't get to go to their homecoming. So again, this was a way of working with the community, and there were some parents that weren't real happy, but it was about keeping people safe, because those kids were literally eating dinner, drinking before or drinking after, or drinking while they drove to the high school. So in the end, you have to say, how many lives are we saving when we talk about this, when we talk about this collaboration and we do these kinds of things together. Again, graduation in Roanoke County, they have a no-walk policy. If you get caught drinking or any other drugs within 30 days of graduation, you can graduate. You are not allowed to walk across the stage. And Dr. Lang stands very firm in that. A couple of years ago, there were 3 that didn't. And a couple of the parents thought that they could bring in lawyers, and we said, that's the policy. And it was, you know, blessings in disguise, good lessons learned. Okay. I'm just going to, again, mention GADAP. This is their mission, Changing Lives Through Leadership, and CCOVA, this is Community Coalitions of Virginia. You can Google either one of those and get tons of information. Okay. Another implementation of providing support are the youth. We are extremely fortunate. We have 4 what we call community action teams in all areas of our county, and we have a very strong youth leadership. When I present, and if I could have pulled one of them out of school today, I would have. I present with youth, especially at the elementary level, PTA, because me standing up and giving those numbers to other adults, sometimes it glazes over. When those youth are there and they talk about how true it is and what is in their lives, then that really impacts the adults in the community. So this happens to be a couple years ago. That was the Roanoke group that came from city. It was from several different high schools. Okay. Goals and visions of YADAP to develop young leaders who will make positive contributions to substance abuse and violence prevention efforts, and to promote and support the use of effective youth-led substance abuse and violence prevention programs. They actually work as a team, and then they go back into their community and they actually play out what their what they call stand plan strategies to act now. So they actually have to get together and they go through a process that's very similar to what we're looking at now. Again, anybody do anything with Four Loko a year? It was about a year ago that this all came out. Okay. This was something that the youth got right on. They actually learned about it at YADAP, and we had media coverage at the Board of Education and Board of Supervisors, because there were so many adults that had no idea the contents of Four Loko. And it's now been remanufactured. They took out the caffeine. They still got the 4 years in it. So. Okay, this is Sam Spady. Anybody know her? Anybody heard of her? Okay. She lost her life in 2004 as a 19-year-old at Colorado State University. Her mother does tour the country talking about this. She's been to Roanoke. It's very easy to get her. When they found her, her BAC was a .436. And the most recent one is from Radford University, and at time of autopsy it was .48. One of our media at WDBJ7, the reporter went to the Candlelight Vigil a year ago, and she said, I was so jaded because those fraternity brothers were literally at this and sort of like, okay, we're gonna have a drink for you, Sam. We're gonna have your favorite drink. And I told her, I said, you know who that I look back at and ask why? Is I look at those students, those 19, 20-year-old guys. I look back at who are their parents and who are their guardians that are not talking to them. Because we cannot continue to say, oh, these kids should know better. Our brains are not fully developed till 25, and we as adults have to take responsibility of talking to our youth a long time. It doesn't stop at age 12, or it doesn't stop when they go into high school. This is our Carillion partnership. In 2007, we responded to the surgeon's call to action, and we now have a brochure and information. It's called Silence Isn't Golden, It's Permission, that at 6th grade checkup, when they have to go in to see person in the white coat to get their immunization, that this prompts them on their EPIC level at their computer, and they have to give this information out to the parents and have that discussion. We now have data from parents that have been going to see the doctor from 6th grade level, and we're starting to do things at the 9th grade, because that's another very critical time, going and having this discussion from a health perspective. Okay, this is sort of what it looks like. This is on their EPIC system, so that was a big change of policy. And then we also, when there's time on, or when there's space in the prescription, they started to do some things like this about just data about prescription drugs and why it's what's happening with teens. Okay, so what drives the outcomes through prevention is really the education, collaboration, and opportunities. Anybody have SAP in your schools here? Student Assistant Program Coordinators? Okay. So we are again very lucky. Joey Burkholder brought in that SAP program into all of the county schools, all the way down to elementary. We did lose the part-time SAPs in elementary 2 years ago because of budget cuts. We have maintained them in the middle and high school. They are the first line of prevention in middle and high school. And parent education, and then the youth piece. Our unique partnerships have begun to grow. We are now partnering with the YMCA at the federal level. They are a partner with Office on Drug Control Policy. We just had our Eat Dinner with Your Family. It's a national movement, the 4th Monday of every September, and they were a partner with that. So we just had our dinner last Monday night. We're doing a very unique project this year with Roanoke Children's Theater, thanking ADC for a grant that we received. And that will be between October 18th and the 30th, and that production will be wrecked, and we are aiming it at every 9th grader. We'll have every 9th grader there from the city, Roanoke County, and we are looking at one more, possibly Botetourt County is going to be able to come in on that. And every single 9th grader will see this production. It's specifically about underage alcohol use and alcohol in the home. We then will do talkbacks after that, during that time of production, and then we'll have also evening performances. So again, we're trying to get a lot of the community involved and listen to this kind of education piece. So this is all of Virginia, and it just amazes me how large this state is and how far the reach is. Again, we are really trying to help out that very far southwest that is absolutely just dying because of the prescription drug abuse and the meth down there. And then we've got community coalitions, and Jack Claypool oversees over 700 of these across the country. I saw him on Friday, and again, he would love to have, he actually lives in Virginia, and he would love to have a DFC in every single one of those counties. So if you are in an area that doesn't have a DFC, you have every ability to write one. And it is an incredible program that comes to your community. 92 cents of every one of the dollars comes directly to the community. And this is bringing the community together so everybody can be part of the solution. So that's sort of in a nutshell, big picture. And I think we're going to get more specific when we go into a breakout session.